Hello, my name is Shep Weiner. I'm the Medical Director of the HCM Center at NYP Columbia, and we're excited to be participating in HCM Awareness Day 2023. We're a newly recognized Center of Excellence by the HCMA as of June of last year, and it's been a privilege to participate in some of the programming that the HCMA puts forward, including today's activities. I'm the Medical Director of the HCM Center, as I mentioned. I've been doing that for about 5 years. Prior to my involvement in the center, we were led by Dr. Matt Moore, who's a heart failure cardiologist now specializing in restrictive cardiomyopathy, specifically amyloidosis. And I took the program over from him, and I've been happy with the progress that we've made in terms of the patient care experience that we have at Columbia, the surgical expertise, and some of our research efforts. I'm joined by Dr. Hiro Takayama, who is our surgical director, who is a true expert in cardiac surgery, including septal myectomy and mitral valve repair for HCM patients, and Dr. Jay Shimada, who's our research director, who's been extremely successful in securing funding and publishing within the HCM community. We have many other people here that help us manage HCM patients, and we have expertise across the board in terms of the services that are provided. We really try to follow the American Heart Association, American College of Cardiology guidelines about what a comprehensive HCM center should offer in terms of all the diagnostic and therapeutic options. Dr. Angelo Viviano and Dr. Fritz Ehlert are two of our electrophysiologists that help us manage those issues related to HCM patients. We're fortunate to have Dr. Jeff Moses, interventional cardiology, to perform alcohol septal ablation when needed. There's a long history of heart failure excellence at Columbia, and Dr. Nir Uriel is the Director of Heart Failure and Transplantation, and his team assists us in patients who require more advanced cardiac care. We have an imaging program led by Dr. Jay Leb, advanced imaging, including cardiac MRI. We have a genetics program led by Dr. Jessica Hennessy, pediatric cardiology with Dr. Mark Richmond, and administrative support at the program. The approach we try to take is really a teamwork model of HCM care, where we work together to provide the best patient care experience for HCM patients. We try to coordinate the patient experience. Patients will come through and see me, and then have any of the available subspecialties that are required in their management. And an important part of this is communication and collaboration between team members, and really respect for individual needs and preferences. A shared decision-making model is one where we employ, where we want patients to understand their conditions and be active participants in the decisions that are made with respect to their care. We're pleased to have been involved recently in clinical trials that have made it an exciting time for HCM patients, including the Explore HCM study, which led to the approval of Camzyos from mavacamten for the relief of symptoms in patients who have obstructive HCM. We're also an active investigator site for the Sequoia trial, looking at the second-generation molecule, aficamten. In terms of education, in partnership with the HCMA, we were excited last month to be a presenting center for the Big Hearted Warriors Unite program, where we led an evening of presentations to further educate the HCM community about some of the exciting advances and also challenges that we still have in managing HCM patients. Again, a day like HCM Awareness Day is another wonderful opportunity to further those goals and improve the experiences of patients who have HCM. So it's a pleasure to be joining you today, by video, and really look forward to continuing to work with the HCMA in the future, and available to meet the needs of any HCM patients that require specialty care for sometimes complex decisions that are required for management. Thank you. Bye-bye.